Riley. Hello. My name is Kathy. I'm a nursing assistant today. We're going to get you up out of the bed in a wheelchair and take you down to the activity for this morning.
Okay.
First thing I want to do is check the bed wheels and make sure they're locked. Okay, here we go. I'm going to raise you up in the bed a little bit just so you can be partially seated. Shoes on. Okay, now I'm going to just sit you up on the side of the bed and let you sit there for just a minute. Okay, let's put your feet just off the bed here. Ready? 1, 2, 3. Okay. Scooch up just a little bit and let me on the floor. Okay, so onto the mattress. You sit there for a second. Are you okay? Put my little belt around you. Give me something to grab other than you. Okay. Go around your waist. And we'll get it snug, but let me know if it's too tight, okay? Is that too tight?
No.
Okay. Now, let me put my foot right here and right here. On the count of 3, we're going to stand, we're going to turn, and sit. Okay? Alright. I want you to put your hands right here. And I'm getting close. Here we go. Ready? Okay. 1, 2, 3. Up, turn, sit. Okay. Legs to the wheelchair. Put the legs on the wheelchair. Okay. The skill. Okay. Alright. Now, let me unlock your wheelchair. You can go call there. You can on me if you need anything. Okay? Thank you. Washing my hands.
Moving a client in bed. To perform this skill, a hospital bed with side rails is required. You may also use a trapeze, if available, and a turn sheet or draw sheet. When moving a client with one nurse, begin by washing your hands and apply gloves if needed. Inform your client of the reason for the move and explain how the client may assist you, if able. Elevate the bed to your waist height to reduce the risk of straining your back. Lower the head of the bed if the client can tolerate this. Lower the side rails on the side where you are standing. Remove the pillow so it is not in your way and place it against the headboard for your client. Ask the client to fold his or her arms across the chest or to hold the overhead trapeze to help prevent injury. Assist the client to bend at the knees and place feet flat on the bed if able. Stand at an angle to the head of the bed, feet apart, knees bent, feet toward the head of the bed. Distribute the weight of your client evenly by sliding one hand and arm under the client's shoulder and the other under the client's thigh. Rock forward toward the head of the bed, lifting the client with you. Simultaneously, have the client push with the legs. If the client has a trapeze, have the client pull up, holding onto the trapeze as you move the client upward in bed. It is often not feasible to move large or very immobile clients far enough in one step. Repeat these steps until the client is high enough in bed. Place the pillow under the client's head. Elevate the head of the bed, if tolerated, and assess the client's level of comfort. Also, adjust the client's bedclothes as needed for comfort. Elevate the side rails and lower the bed. Wash your hands. When moving a client with 2 or more nurses, wash your hands and apply gloves if needed. Again, inform your client of the reason for the move, and if the client is able, explain how he or she may assist you. Elevate the bed to your waist height to reduce the risk of straining your back. Lower the head of the bed if tolerated by the client, and lower the side rails. With 2 nurses, place the turn or draw sheet under the client's back and head. The sheet will help reduce the shearing force of the move, which can precipitate pressure sores. The draw sheet should be placed under the shoulders and hips and may extend to under the head if needed. Roll up each side of the draw sheet until it is next to the client. This is to support the heaviest parts of the body and keep your hands close to the weight you are moving. Ask the client to assist by either folding his or her arms across the chest or holding onto the trapeze if available. Stand on both sides of the bed at an angle to the head of the bed. You and the other nurse should stand with knees flexed and feet apart in a wide stance. Hold your elbows as close as possible to your body so that the torso, as well as the arm muscles, can assist in bearing and moving the weight of the client. The lead nurse will give the signal to move, using the command 1, 2, 3, go. Both nurses then lift the turn or draw sheet up off the bed and toward the head of the bed in one smooth motion. Simultaneously, have the client push with the legs or pull using the trapeze. Repeat until the client is high enough in bed to be comfortable. Large or very immobile clients may require several lifts. Place the client's pillow under his or her head. Elevate the head of the bed, if tolerated, so the client can eat or drink comfortably. Then lower the bed and elevate the side rails. Assess the client's comfort and adjust the bedclothes accordingly. Wash your hands. Turning and positioning a client. For this procedure, you will need pillows, some rolled blankets or towels, and heel protectors. Provide for your client's privacy. Begin by washing your hands. Elicit the cooperation of your client by explaining the procedure thoroughly. Make sure you have the assistance you need to physically move the client safely and to prevent strain to your muscles and back. To further prevent injury to yourself or the client, always follow these guidelines. Adjust the height of the bed to a comfortable working height. Lower the side rail on the side of the bed from which you are assisting the client. Be sure the floor is not slippery and that the bed is locked. Position yourself by assuming a broad stance with your feet apart. Position one foot slightly in front of the other for balance by placing your foot that is nearest the head of the bed behind your other foot and slightly bend your knees. Maintain the natural curves in your back while lifting. When your arms are placed under the client, slowly lean backward onto your back leg, using your body weight to help you lift the client to one side of the bed. Use a draw sheet when turning a client if this gives you better support and control of the client. To prevent accidental dislodgement or discomfort, position drains, tubes, and IVs to accommodate the new position. Place or assist your client into the appropriate starting position. Monitor the client's status, providing adequate